Hi, my name is Karina McLennan, and I'm a senior here at South Dakota State University in the Human Biology Department. Over the past year, I've been working on my research project over a disorder known as Body Dysmorphic Disorder. This research is mostly directed at student athletes, athletic trainers, and coaches here at South Dakota State and many other universities. BDD is a form of somatoform disease. For those of you who may not know that, somatoform disease is a mental illness in which a patient comes in with a physical symptom that cannot be explained by any medical condition. A more commonly known form of somatoform disease is persons such as a hypochondriac. BDD specifically is when a patient lacks the ability to focus on anything except their distorted feature of their body. So for example, if I were to look in the mirror every day and think that my nose is super crooked even though it's not, and my nose is something that I just become obsessed with. So my goal was to set out onto the campus of SDSU and survey some athletes on campus to see if anyone may have underlying BDD. My original hypothesis is that female athletes at SDSU would struggle more than male athletes at SDSU. The survey's questions were directed at how the athletes viewed their body, how certain features affected them, or if certain features actually affected their ability to be social or get out into the social world. After analyzing and going through my surveys, I determined that 10% of SDSU female athletes and 1.67% of SDU male athletes may be suffering from underlying BDD. Overall, 8.46% of SDSU athletes may be struggling from underlying BDD. Not only did I find out these percentages and how many people may be suffering on campus, but I also broke down some of the questions. So question 7A specifically asked the athletes if they had a specific feature that affected them most. Both males and females said that their waist and facial features were something that truly affected them. A lot of times you can see females struggling with the ability to get those curves in their waist, or males on the other side wanting like rock solid abs. After that, it did diverge in which females started focusing more on the bottom half of their body and males started focusing more on the top of their body, like their chest and their arms. Diving even deeper into it, I broke down some of the highest rated questions, which actually played into some of the knowns in society today. So for females, their highest scored questions was number 20 and number 4. Number 20 and number 4 asked if they compared and if they would like to change a certain feature. So in today's society, females are actually more known to attempt to change their distortion, or males are more likely to want to hide their distortion. So their highest rated questions actually played into that known, and so did the males. The male's highest rated question was number 5, which asked if you caught yourself looking in any reflective surfaces obsessively. So if you're walking down the street and you're checking yourself out in the window all the time. That also played into known because in that situation, males be wanting to check to see if their distortion is being seen or if it's hidden enough. Overall, body dysmorphic disorder is a severe psychological illness and actually has a big effect on how people can live day-to-day lives, and can also lead into other things such as depression or anxiety.
To finish off my conclusion, I wanted to bring you in closer to my poster so you can clearly see the words, graphs, and tables. As I mentioned before, BDD is a severe psychological disorder, and in the general population, about 0.7 to 2.2% of people struggle from BDD, where on a college campus, about 12% of college students can suffer from BDD, with a great portion of that being athletes. The fact that a large portion is athletes is why I pursued this research topic. I also decided to dive deeper into the topic of BDD because of the lack of research and treatment found for this disorder. As of right now, the only treatment is cognitive behavioral therapy, where a doctor tries to change the way the patient thinks or views themselves. Out of the 585 athletes on campus, 50 of them may be suffering from underlying BDD. Having the awareness of BDD in their athletes as athletic trainers and coaches is important so that they confront and put a stop to this way of thinking before the disorder gets too serious.